In the United States, about 85% of adults consume caffeine daily. So I know not everyone here is a coffee drinker, so I want to provide some further context. Well, hello, mighty family. Welcome back to another segment of Dr. Eric Debunks. Today, we're going to debunk something really, near and dear to my heart, and it's one of the most commonly consumed drugs in the world, and that's caffeine. I got my cup right here. I know I simply can't live without it, so I always got my cup with me every morning. And I know we have a lot of caffeine lovers out there in our mighty family, so I hope you find this segment informative and exciting. Okay, so the first question we all want to know is caffeine bad for you? Well, I think to answer that question, we first have to determine what is considered normal and safe caffeine intake. So surprisingly to me, in the United States, about 85% of adults consume caffeine daily. And the average caffeine intake is about 135 milligrams a day, which is about a 12-ounce cup of coffee. So I know not everyone here is a coffee drinker, so I want to provide some further context. So a cup of black tea is about 47 milligrams of caffeine. A cup of green tea is about 30 milligrams of caffeine. A bottle of Coke will be about 32 milligrams of caffeine. And all the energy shots we should be staying away from can be up to 200 milligrams of caffeine. So with that said, research studies have shown that up to 3 to 5 standard cups of caffeine, or even up to 400 milligrams of caffeine daily, is not only safe, but shown to reduce risk for multiple chronic diseases. So to really hit that limit of 400 milligrams of caffeine, you really have to consume quite a bit of coffee, tea, and even soda. So all to say, the amount of caffeine most people regularly consume each day is in fact good for them and is safe. So now let's take a big picture of some of the health benefits of caffeine, especially in the form of coffee. So as we know, number 1, caffeine increases alertness and helps with concentration. But 2, it can also improve our moods and also reduce depression. 3, lifelong consumption has been shown to prevent cognitive decline as well as decrease risk of strokes, Parkinson's disease, and Alzheimer's. And I know 4 is something that we've all felt in that caffeinated coffee increases colonic motor activity, so this can help with your bowel movements. And 5, it has been shown to decrease the risk of both kidney stones and gallstones. And 6, in cohort studies of habitual coffee consumption, this has shown consistently to be associated with reduced type 2 diabetes risk in a dose-dependent relationship. And lastly, overall consumption of 2 to 5 standard cups of coffee per day has been associated with reduced mortality in cohort studies across the world. So if I were to summarize all this up, I would say coffee or caffeine has numerous health benefits and is overall very safe. Now I want to address something that I've heard quite commonly, and that's caffeine can be addicting and it can cause withdrawal headaches. I want to reassure you all that caffeine is not an addictive drug. And the reason being is that it has no activity in the reward centers in our brains that is responsible for causing addiction. In regards to causing headaches when stopped, well, there are some truths in that. The exact mechanism is not known, and it's thought that it's due to caffeine's ability to affect the blood flow in our arteries in our brain. However, the withdrawal headaches rarely last more than 48 hours and typically ends by the 7th day of caffeine cessation. So in terms of directly causing headaches, caffeine intake is not known to cause them. In fact, there has been really good studies showing that people that suffer from tension headaches or even migraines, they may actually benefit from caffeine intake with their over-the-counter pain medications because it has a synergistic effect. And this is why you see so many medications on the market, like Excedrin. And for our members that do get migraines frequently, the recommendation is really to just stay consistent with the amount of caffeine you consume regularly, as changes in the amount that you consume can be a potential trigger. So the next question is, what about the effects of caffeine on our stomachs? Doesn't it cause acid reflux and stomach ulcers? Well, there's some truth to this one as well. So caffeine is known to stimulate stomach acid release, as well as relax the sphincter or the door between our esophagus and our stomachs. These in combination can certainly exacerbate those acid reflux problems, or potentially worsen symptoms of gastritis or those with gastric or intestinal ulcers. In terms of caffeine directly causing ulcers and acid reflux, a meta-analysis study enrolling more than 8,000 healthy subjects detected no significant association with coffee intake and acid-related diseases. So all to say, for those with acid reflux problems or gastritis-related pains, it will be beneficial to cut down the amount of caffeine in your diet. All right, time for me to take a sip of my coffee as a little break. So I know we mentioned all the great benefits of caffeine so far, but I do recognize that caffeine is not for everyone. So I want to take a moment to highlight situations where caffeine intake may not be for the best. For those that are very sensitive to caffeine, it is known to raise anxiety in some people. So it may not be good for folks that are already dealing with anxiety at a baseline. And two, for those that struggle with sleeping or have insomnia, I would just stay away from caffeine and attempt to get a better night's rest. And then lastly, if you're pregnant, I would also generally try to avoid caffeine, as it has shown to result in lower birth weights and higher risk of pregnancy loss. Okay, Mighty Family, I hope this was an exciting topic for you as it was for me. But before we kind of wrap up, this quick segment, I want to impart with you one last thing, and that's not all caffeinated drinks are equal. The second we add the sugars, the artificial creamers, those health benefits are soon tainted. So just for an example, one of the most commonly ordered drinks at Starbucks is an iced white chocolate mocha. And I want to run through with you some of its nutritional facts, because I do think it's so important to really understand what we're putting into our bodies. So for a 16-ounce grande, from a calorie standpoint, it's about 420 calories. And just for some context, a burger that you may eat for lunch is about 300 to 500 calories. So as you can see, this drink is quite calorically dense. So the next thing I want to comment about this drink is just its carbohydrate content. So it has about 49 grams of carbohydrates. This is about the equivalent of 3 slices of white bread. And then kind of more concerning is the amount of sugar is in this drink. It has 48 grams of sugar in it, and that's 12 teaspoons of sugar. And lastly, this drink contains 150 milligrams of caffeine. So as you can see, with this one drink alone, it contains so many grams of sugar, so many grams of carbohydrates, and is so calorically dense that the health benefits we would gain from the caffeine are surely negated. So I think my takeaway from this episode and kind of just my research debunking this, these various topics, is just to continue to enjoy my morning black coffee guilty-free, and maybe with a splash of milk, because that never hurts. All right, Mighty Family, that kind of wraps up our segment for today. As always, I look forward to connecting with you all again soon. And for those that are not part of our Mighty Family just yet, check us out at mightyhealth.com for more. We're striving every day to be the modern, holistic home for healthy aging. Thank you so much.